one. And this is the thing. So, I asked you guys to come out because we know it's Medicare season, right? And praise God, I do have a number of clients. And it's easier for me to talk to all of y'all kind of one time than to, can you talk to me? Can you talk to me? So, most of you guys know me and know, I'm your agent. So, y'all know I just cut it straight to the point, no traces. Just give you exactly what's going on. And so there are, how y'all doing? It is Medicare season. You guys are getting all kinds of calls. You all are getting text messages, calls, you getting flyers. We're gonna be at the Walgreens, the CVS, the Superlows. We're gonna be everywhere, okay? And people gonna be, come let me talk to you. Come over here and talk to me. Now, I will tell you this. If they say come over here and talk to me, they don't broke the law.
Oh, okay.
No, literally, they have broke the law. It is against the law for us to solicit. No one can solicit you for Medicare. It's not like car insurance. We can't put a flyer on your car. It's not like the people trying to sell records. We can't be in the parking lot of Walmart, so I can be your Medicare agent. I can be your Medicare agent. We can't do that. It's literally against the law for a licensed agent to approach you about Medicare. Now, you say, well, why y'all calling me? We're not calling you. The licensed agent is calling you, it's against the law. Now, if the people all across the world are calling you, they call you. Because they're not licensed. And they can call you. And then when they get you on the hook, because you qualify for more benefits. All right. Once they get you on the hook, you get to talking, they're going to transfer you to a licensed agent. Okay? Whoever you enroll with is your agent. They're responsible for you. They're getting a commission for you. So, whoever you talk to on the phone, whoever you enroll with, that's who you got to call back. Now, if people call me, and I say, oh, who's okay. Now, I'm going to help you. But I've had to learn to say, who is your agent? I really have had to learn to do that. So this is kind of Medicare 101. A lot of this we already know. It's going to work. Nope, not going to work. Oh, here we go. Maybe it's going to work. Not going to work. All right. So, what we're going to do is, okay, good to go?
Yeah.
All right, look at me. All right. So, get started, history of Medicare, Medicare eligibility, what Medicare covers, what are your Medicare options, what are the important dates, and what are the costs. So, one of the things is, we are in, what is Medicare? Medicare is not free, okay? Medicare is the federal government health insurance for United States citizens and legal citizens for the United States. It is the United States health care, so that's gonna be important as we get down in here. It is funded partly by your taxes you pay while you're working, and then the rest of it's funded when you get it, Part B. And it's an individual health insurance, so people have asked me, can I put my husband, my wife? No, it's yours. It's an individual health insurance, okay? What Medicare is not, it's not a family plan, it's not Social Security, it's not Medicaid, and the most important thing right here is, it is not free. It has never been free, okay? So some people was like, well, they told me that I wouldn't have to. No, everybody pays for Medicaid. Oh my God. Everybody pays for Medicaid. Medicare. Now, some entity may be paying it for you, but your name is hooked to a payment, okay? Because if that entity decides to stop paying it for you, you still owe it, okay? So. Okay, quiz. How long has Medicare been around?
65.
65.
All right, let's get paper. So Medicare is not 65 years old. Okay? Medicare itself is not 65 years old. So, Eisenhower, I believe. So Medicare, well, it's legal. You got to be a legal resident. You got to be 65 years old. Okay? Certain cases younger than 65, you can get Medicare. ALS. Don't want to be in those situations where you can actually get Medicare before you're 65 years old. Because you're sick. You're on disability, you got ALS, or you got end-stage renal disease. Okay? Some of the disabilities are breast cancer. Some of those type of things. One of the biggest things that I want the community to know is that dementia, Alzheimer's, is not a disability. It is not a disability. It is not considered a disability. Now, we all know that's crazy, because if you don't know your own name, you are disabled. But it is not considered a disability. So when you turn 65, you may be entitled to Part A and entitled to Part B. You have to have an entitlement in order to actually get on it. So you are entitled to Part A if you have paid for it while you were working, okay? Paying for it if you've worked 40 quarters, which is 10 years. You've already paid for Part A. So I don't like to say free, but it's $0 cost, Part A. So if you continue to work after 65, you may get a card that says Part A, and it does not say Part B. If you're not getting, I may be getting a little bit ahead of myself, but if you're not getting your Social Security check 4 months before you turn 65, they don't know whether you're working, they don't know what you're doing. So they will not auto-enroll you. You will not get an automatic auto-enrollment from Social Security. So you may get that card that says Part A only, okay? They don't really know what you're doing. Talks about you may be eligible for premium free, because why? You've already paid for it. So what happens when I never work? Okay? What happens when you never work and you pledge your life to that good old man sitting beside you that did work? You get to use his. Okay? You get to use, what you say? Praise the Lord. Praise the Lord. You get to use your spouse's quarters. Why? Because in 1965, most women were not working. So what were they gonna do about their health care when they turn 65? So if your spouse has worked those 40 quarters, you get to use theirs. Okay, so praise the Lord. Now, if you never worked, you don't have a spouse, okay, we're gonna go to the next slide. Yeah, that's a whole nother situation. So what are the 4 parts to Medicare? Part A is your hospital. It's just simply, Part A is what you use when you go inside the hospital and you admit. Part B is what you use everything on the outside. So that's the simplest way I explain. If you're on the inside of the hospital, you're using Part A. If you're on the outside of the hospital, you're using Part B, okay? It is provided by the federal government. You say I just had to pay for it, but it is provided by the federal government, okay? Part C. Part C is a private company. That Advantage plan is a private company, okay? Now, your Part A, your federal benefits, Part A and Part B, if you get on an Advantage plan, is rolled into the private company, okay? Part D, your prescription drug, is private. So, you may hear if you get in certain situations, and this usually happens if you're on an Advantage plan and you have to go into a nursing home, or you have to have longer than 20 days skilled nursing. And people will say, oh, you're not on original Medicare. When they say original Medicare, they talk about Part A, Part B. Your bill is going to the federal government. A lot of this boils down to the money. They follow the money. Who's paying the claim? That's it. So if you're on a red, white, and blue card, the government is paying the claim. If you're on a private company, after the government pays its part, the private company is paying the claim. If you plan zero, then that's another set, okay? Your prescription drugs, that's a big top right now. Because they're switching who your payers are, you know, so we're gonna go over that, but that is the private company as well, alright? Regional Medicare, Part A pays for your hospitalization, pays for skilled nursing facility, it pays for hospice, and pays for home health. Part of Part B pays for home health as well. Your Part B is your doctor's appointments, your outpatient, your physical therapies, your MRIs, your dual medical equipment for your diabetes, your canes, your hospital beds. All of that is under Part B, okay? Anything that's happening outside the hospital is gonna be on Part B. True or false? Medicare has an annual max out-of-pocket limit. I should've brought me up.
So we'll ask.
Out of
You would-
pocket?
So
I said
Yeah.
something.
Mr. Reed,
Medicare.
is there a maximum out-of-pocket limit for Medicare?
Yeah.
Yeah.
No.
Really?
No,
No.
my friends, I told y'all that.
Hey,
I didn't tell y'all that. There is no, not yet, there is no maximum out-of-pocket for original Medicare. It is dangerous, it is absolutely dangerous to be on that red, white, and blue card alone. You cannot afford it.
Right.
I don't care how much money you got, if you got a whole lot, I might need to borrow some, but you cannot afford it. If you don't have $1 million liquid, you can't afford it. And I said liquid, I ain't saying your house and all that, I said liquid, you go to the bank and get it, you can't afford it. And then you don't wanna put your $1 million on digital Medicare, I mean, you don't wanna spend that kind of money. False. Okay, Part A. So, and this is about to change, they haven't sent these out yet, they haven't gave us the new update. But, if you are on original Medicare, your deductible, like when you work a job, is $16.32. So when you hit that emergency room, and they admit you, it's $16.32. Medicare runs on a 60-day cycle. If you go in January, it's $16.32. If you go back in May, it's $16.32.
$1,632.
$1,632.00. If you go May 1st and you go home and you come back May 30th, you're still on your $16.32 because it's a 60-day cycle. Okay, now once you've paid your $16.32, you're gonna owe 20% of the Medicare allowance. Now, what's Medicare allowance? So Medicare is not gonna let the people charge them too much money. So they may charge $10,000, but Medicare say you're gonna charge me $5. Okay? But depending on what you got going on, your Medicare allowance could be $10,000, could be $100,000, could be $50,000. Okay? You're gonna owe 20% of that. Okay? Now, that's for the first 60 days that you're in the hospital. Now, if you get to 61 days, you owe $408 copay per day on top of your $16.32. Because now your 60 days is over. So now you're in the 61 to 90 days. You owe $408 per day. So if you get to 71 days, you owe all of that plus another $4,000. Days 191 through 150, $816 per day. You got a 60-day lifetime reserve that you can throw in there. After 151 days, you owe it all. Okay? Okay, everybody here? We cannot afford original Medicare. We cannot. So we got some options we gotta talk about. Okay, This is what you're paying for. You're not paying for the Advantage plan, most of you, but you're gonna pay that Part B premium. It's $174.70 for 2024. We have not got the updates, okay? So the Part B premium is $174.70. The annual deduction is $240. So you go into the hospital, spend $16.32. You get out the hospital in 3 days. They say go to your primary care doctor. Now you owe your primary care doctor $240. It's your deductible. Okay. Now, what Medicare gonna pay? Medicare's gonna pay 80% after your deductible is paid. You're gonna pay 20%. And there is no max out of pocket. So what does that mean? There is no stop. We cannot afford original Medicare. Okay? So, and it's $174 if your modified adjusted gross income is $103 for an individual and $206 for a couple. Okay? So if it's greater than that, you will pay more than $174 for Part B. If it's greater than that, you're gonna pay more for Part D as well. So, my retirees, I tell people, when you're getting close to retiring, and you done worked, and you've done the things you're supposed to do, you got your 401k, you did your IRA, you did your money market, you got you some stocks, you've done all the things you're supposed to do to set aside so that when you retire, you can do what you wanna do. You can't draw all this money down. Couple of reasons. You're gonna get another tax credit. So you don't wanna do that anyway. Another reason, it's gonna count as your income. You're gonna pay more for your Medicare. So we're gonna be rolling over some of that money. We're gonna keep rolling, and keep that to get some interest and gain some more stuff as we pulling it out little by little. Because you're gonna end up paying what we call the ARMA, income related monthly adjustment amount. Okay? Now, Medicare has a 2-year look back. I have a client right before she retired. She worked a lot of overtime. She's single. She made like $165,000 last 2 years she worked. So she paying this armor, and then next year she gonna pay it again because it's a 2-year look back. Every year they're looking back 2 years. Okay, so for these 2 years, depending on how much money you make, you're gonna be paying an armor. Depending on how much money you getting out of your 401k in your retirement, you're gonna be paying this adjusted amount. We don't wanna pay extra, okay? Services not covered by original Medicare. This is so important. Get these calls. None of us wanna be here, but we're gonna have to prepare because we don't ever know if we're gonna be here, okay? It does not pay for custodial care. That's when someone's gonna help you get dressed, transfer, take a shower, eat, all of those type of things. It does not pay for that. It does not pay for hearing aids. It does not pay for dental and vision. It does not pay for travel outside the United States, because this is whose insurance? The United States insurance. They don't care that you're in Barbados. They don't care that you're on vacation. They're not gonna take your red, white, blue card in another country. Okay? Long-term care, it does not pay for that. Okay? Remember, dementia is not a disability. Medicaid is not an option. So, I'm gonna talk a little bit about people in this room. We already here. So one of the messages is to what? Go back and talk to the family, to the children, to the uncles and the aunts and the nieces and the nephews, because they need to be planning for this right now. Because how many of you all knew this before you got there? No one. We didn't know to prepare. So we got that message now because we got to tell them to prepare. Okay? You can still get these things, but the amount of money is very expensive. And so we have to help our children help us. Okay? Because most of us, children can't stop working right now to take care of us. They can't. They can't afford it. They got their own children, they got their own grandchildren, they got their own bills. So them to try to come over to take care of you every day, it's gonna be hard on them. So either we gotta have some of this policy stuff, or we gotta have our own money to help them help us. Okay? So they can either be paid, come home and be paid, or they can pay someone else to come in while they're working. Okay, so when are we gonna enroll? When you turn 65, you got 3 months before you turn 65. You got your birthday month. And then you got 3 months after. So everybody in here is pretty much ours except one is we getting there. But you got those you've already enrolled into Medicare. Okay? So now I have original Medicare. Special enrollment periods, that's talking about, some people think they can just get on Medicare when they want to. You can't. If you miss that 7-month period and you didn't work a job and you don't have a reason, the reason why you didn't get on it, you're gonna have to wait till January, between January and March. So if you decide you wasn't gonna get on it and your last period was May, that way all in January. And if you 65, ACA does not wanna pay for your bills. Why? Because you're supposed to be on Medicare. So now what we're gonna do? They've changed the rules for short term. So we wanna enroll, your spouse is actively working, so special enrollment periods allows you, the individual, to enroll at a later date. So when can you enroll in a later date with no penalty if you're working? You have to be on a job working group insurance. What does that mean? Not your retirement insurance. Not the insurance that you're getting from the school system because you retired. Not the insurance you're getting because you work for Miss Like Gas and Water, FedEx. All those major companies that offer you a retirement insurance, post office. No, that's not credible coverage. You have to have credible coverage. If you do not have credible coverage, you are going to incur a penalty. If you working, you got 8 months after you leave to get on. General enrollment from January to March. Okay, we talked about that. So, what if you do not enroll? 10% penalty. Remember, it's $174. It's a 10% penalty for every 12-month period for the rest of your life. The rest of the good breathing life. So when people tell me, right, when they tell me, I don't want to pay $174, I can't afford $174. Well, guess what? If you can't afford $174, you sure enough can't afford $180 something, or $190 something, or $100 or $200, $300, $400, $500. When you call the Social Security office, they will tell you, you don't have to enroll. You know why? Because you don't. They didn't lie. They told me I didn't have to enroll because you don't. They didn't tell me I was going to get a penalty, but they told you the truth. You don't have to enroll. Because no law says you have to enroll. But you will get a penalty. That will be your gift to not enroll.
Why did they tell you that?
You call Social Security, they're not Medicare experts. Our money is directly related to our health. Your money is directly related to your health. Pastor Weeden, your money is directly related to your health.
But if I call a professional person, they ought to have the courtesy to tell me that I need to enroll. Don't say, you don't have to enroll. And knowing that I'm gonna get a penalty if I don't enroll.
They don't care. Well, first of all, I'm not gonna say that they don't care, but I am gonna say this. You call Social Security. Social Security is your money. You go through your money to get your health care. They're directly related. But that is not Medicare. Social Security, you get a customer service person, right?
Yeah.
The law is that you do not have to enroll in Part B. That is the law. So they have told you the truth. Now, would it be kind for them to say,
I wouldn't think so.
if you don't do this, Mr. Briggs, that you can incur a penalty, okay? So, but they are not Medicare. They're filling out your application for Medicare. They're not Medicare. They're not Medicare agents. They're not licensed. They work for Social Security. Okay? They did not lie to you. They did not lie to you.
Yes, he did. No, I don't.
They didn't tell you the whole story, but, and then, the thing about it, like today, who just got hired? Everybody just got hired, people don't know. But I just tell people, they didn't they didn't lie to you, but, they gave you the responsible law answer, but then they didn't do this other part and discuss penalties and that kind of stuff, okay?
Right.
So we have a Part B penalty. We also have a Part D penalty. Okay, so we'll talk about that. Let me go ahead and tell you that. Part D is 1% of the average for every month that you did not have a credible coverage for Part D. What you talking about, Willis? So, credible coverage is VA or a working group job insurance. You don't have to enroll, but your penalty will be 1% of every month. Part B was every 12 months. Part D is every month. Okay? So if you go 2 months, 3 months, 4 months, 5 months, the average is $33.62. So 1%, 10%, I have had people to call me, they at 20 months, 280 months. They had it 5 years, 10 years, So, yes, that is what you're gonna pay, and you're gonna pay it for the rest of your life. Okay. So what are our options? So you say, well, no one should be on original Medicare. You cannot make it off original Medicare. So you have some choices, okay? So, choice one, and when I say original Medicare, whenever you get that Part A, you must have a Part D. That's your Part D trigger. So if you have a card that has Part A and you're not working on a job and your prescription drugs not being covered by a job, you have to have Part D. ACA is not credible coverage. So you can't, people, I'm on ACA, no, it's not credible coverage. One way, job, yes ma'am.
What's ACA?
Obamacare. I do that too. So anybody need healthcare?
Affordable Care Act.
The Affordable Care Act, ACA, Obamacare, the Affordable Care Act. And it's for people under 65. So once you turn 65, you send in a claim, they're gonna say you should be on Medicare. We're not wanting to pay it, okay? So option number one is original Medicare and a Part D. We can't afford that because not only are you gonna pay your premiums, deductibles and stuff up here, you're gonna pay a premium down here. And you're gonna pay for the prescription drug. Okay? Now, so what am I gonna do about this 20% that you keep telling me I owe? What am I gonna do about these deductibles? How am I gonna stop that financially? Okay? Option number two is to get a supplement in Medicare. A lot of financial planners sell supplements in Medicare. Anybody can sell a supplement. Anybody. You wanna sell one? You can sell one. All the private companies have State Farm, Allstate, all of them. Physician mutual owned health. Because no matter what you get in a supplement, it is the same plan. A plan F is a plan F is a plan F, no matter who you get it from. A plan G is a plan G is a plan G. A plan N is a plan N, that's a plan in. It's simply another insurance policy. So what is going to happen, they're gonna bill the federal government for your A and B, that 20%, the deductible is gonna come back, your supplement is gonna cover that deductible, that supplement is gonna cover that 20%. But it's only for original Medicare. So I talk to people that have a supplement, I want some dental, you gonna pay for it? Medicare don't cover dental. Remember, the supplement is only to take care of what Medicare is not doing, right? Medicare doesn't cover dental, vision, hearing. The supplement is only gonna cover your deductible and your 20%. And the people that got Medicare before 2020 have an F, they all their deductibles. Everybody after that, your Part B, you still gonna cover that $240 yourself. It's gonna cover your hospitalization deductible. It's going to, G is gonna cover, G and N is gonna cover hospitalization. Then neither one of them are gonna cover your Part B. G is gonna cover excess, what they call Part B excess, when the doctors can charge a little bit more. N will not. And with N, you would have to pay $50 to go to the emergency room and up to $20 for your doctor's appointment.
And what is the premium? Is
So,
everybody
that's
the
thing.
same, or? Okay,
The premium is what they wanna charge you.
okay, so shop around.
Can I ask you a quick question? I wanna throw y'all. What about, you gotta get right by ambulance, take it to the hospital, they cover that?
Yeah, they do, 20%.
Is that it?
Well, they gonna cover 80%, you gonna owe 20%.
Okay.
You gonna owe 20%. You always owe 20% on original Medicare. That supplement is, it's gonna cover some of that, we're gonna look at the supplement plans, but, remember, it's covering at 20%. So what people, financial advisors, a lot of them advise their people to get supplements. Why? Because you know that amount is coming out of your budget. So they're trying to predict your money. They're trying to predict your budget. Most people that have financial planners got what? A whole lot of money. They got a budget.
Got some money.
Yeah, they got some money. So the financial planner is going to say, well, you're 65, it's gonna cost you about $70 a month. You can predict that $70, because when you go to the hospital, it's no bill. When you go to the ambulance, no bill. You know, you just don't get any bills. So you don't have to worry about it. It's just $70 a month. There's no problems, there's no issue. You got Part B, you know, you get a little $5 premium depending on what kind of drugs. You're pretty healthy. So you don't take but a tier 1, little amlodipine, Losartan. You get your little $10 plan, and you're good. That's not gonna cost you anything anyway, because it's Losartan. It's a tier 1. You're good. Couple of things with that. Your financial planner cannot sell you an advantage plan. I know people like going to supplement. They're not gonna go through the training and all the things it takes to sell a supplement plan. It's a lot, y'all. It's a whole lot. So they like, forget that. I'm managing your $1 million. What is $70 a month for you? I ain't got time for all that. Look, you just get on this supplement. Which it's not necessarily a bad thing. I'm like this, y'all. All tools are tools. I'm not gonna say any one is bad. You see what I'm saying? It's which one fits your life. You know what I mean? So, like them, I'm looking at your money and I'm looking at your health. I'm trying to preserve your money because if your health get bad, it's gonna eat that money up. Okay? So I'm looking at it both too. So that's option number 2. Now, if you got money and, you know, you're sick, if you turn 65 and you got cancer, we might have to do this supplement. Okay, because 20% of chemo drugs, Part B drugs are drugs that you get administered in your veins, in the office, in the cancer clinic, in the hematology clinic. Those are Part B drugs. They cost a lot of money. You're gonna owe 20%. So if you sick, when you turn 65, we might have to do a supplement. If you done already been in the hospital 3 times in 1 year, we might have to do a supplement. Because your Advantage plan has a cutoff. They all have a limit. You know, and they were getting very, very small. They were getting really low, $3,000. you know. You probably could stomach that, but, you know, them Part B drugs, depending on where we are, I may suggest that. And 65 is cheap. Let's talk about being 65. At 65, most of your products are guaranteed issue. That means it no matter what you have, they're gonna guarantee issue. That supplement gonna be a guaranteed issue. So when you sit down with someone, they'll say, you ain't get a supplement. You don't get this supplement today, you never gonna be able to get on this supplement. Ever. Ever.
Yeah.
Never ever. I need you to get it today. Well, part of this is true. It's guaranteed issue today. Not that you ain't ever get on. If you ever, you can get on. You can switch and change. You know, it's people gonna switch and change this year because it's too expensive. It's Part D finna knock them out the box. Okay? So, when you speaking to someone, well, not y'all, because y'all speaking to me. I'm gonna tell y'all the truth. But, you know, just all these ads and stuff out here. Does it fit who you are today? What are we trying to avoid in the future? Okay? So, what I'll do, if someone has a concern, they trying to work between the supplement and an advantage plan, everybody knows what this advantage plan is, because that's why you're here. I don't see a supplement person. Everybody's on this advantage plan, you got a max out of pocket. That means you got a cut off. When you hit that max out of pocket for that year, no matter what you're doing, you're not paying another dime on your medical part, okay? Not your drugs, on your medical, okay? So I have to say, well, let's look at the supplement if you're concerned. We'll talk a little bit about what I call a mini supplement in a little bit. And I said, well, okay, it's gonna cost you $70 to get on this. You're fairly healthy. If you're gonna get on this advantage plan, let's put them $70 up. Can you do it? Yes, no. Some people can, some people can't. But the people that can't, I got some for them. But that's kind of ideal, you know, if you're not sick. The advantage plan, we know what the advantage plan is. That's the Part C. That's what we all on. You married, Sydney, WellCare, Blue Cross Blue Shield, Zing is coming. Devoted is here. It's their third year. Who I'm missing? Cigna, WellCare, WellPoint, Marigroup. It's 8. Yeah, it is 8 companies in the city of Medicare County right now. It's over 60 plans that they constantly throwing in your face. Which one for me? Which one for me? Which one for me? Okay, so we'll go over that a little bit. But that's your choices. Your advantage plans, most of them in a large city does not have a premium on. So when you paying at $174, you're paying for Part B. You're not paying for that advantage plan. Okay. Advantage plan is your job insurance. There you go. The difference we just talked about. The advantage plan is like your job insurance. When you use it, you pay for it. The supplement is like car insurance. You pay for it whether you use it or not. Supplements are gonna go up on average 7% every year. Some of them go up twice a year. Last year, when the data we getting right now, they're going up 13%. So what ends up happening, and the reason why I don't suggest it unless you see it, because what ends up happening at 65, you're what? Healthy. You good. And then it's cheap. By the time we walk over here to 70, we're at about $200 and some a month. That's just for that. Plus the $170 for our Part B, plus our Part D premium. Now we're getting a little shaky. You know what I mean? If we walk on over here to 72, you know, we still all right. 72, 75. We looking at that advantage plan now. This done got too expensive. So we rocking and weaving and rocking. Okay? Now, it's just too much. We jump over into this advantage plan. Well, what happened to them 10 years that you done paid that premium? Where that money? Where's the money? Show me the money. It's at the insurance company. So if you were healthy, you can save. Let's put this money over here in our own bank. So if we have to jump over that advantage plan and pay the copay, we got a little money over here. We put it in a high yield check, we might got a little interest. So that's my philosophy. Supplement plans, Medigap, that's what it's telling you. It's only going to pay for what original Medicare didn't pay for. So on on that route, you're gonna have about 5 premiums. Part B, supplement, Part D, dumb vision and hearing, whatever else you want. That's what you're gonna have, okay? So, this plan right here, F, if you can see, it pays for everything. Foreign travel, 80%. It even paid for the Part D deductible and the excess. That's gone. We can get a Part G or a Part E. I haven't really seen a Part B excess charge, but if you were, you know, you got a doctor come from California, back to Memphis, you know, the prices are different, healthcare is different, so they can't charge the excess. But the premium between G and E is about $40 more. So it's about $480 difference basically because of this base access. The only difference, another thing is in, you may pay $50 if you go to the emergency room. You may pay a $20 copay at your doctor. But that's the only difference. So supplements, I just suggest go to the E. Because it's the same. Anybody can sell it. There is no government regulation that tells a supplement company that they cannot charge you what they want to charge you. There's no limit. They can go up however much they want to go up. And how it works with any insurance. If they got a whole lot of claims, everybody had a heart attack, guess what? It's going up. Everybody had a heart attack. They had to pay 20% of the hospital. Okay? Advantage plan, it covers everything that Part A and B covers. So I've had people to call me, they upset at Cigna, they upset at Humana, Blue Cross Blue Shield, they upset at everybody because somebody told them they need to be at original Medicare, they wouldn't cover it. If Medicare covers it and they don't cover it, you got a lawsuit. They have to cover it. Now they may say I need prioritization. And even this year with the Inflation Reduction Act that Biden signed, when he came into office, part of that, we see a little bit of it being implemented every year. Part of that dealt with that. These companies that cannot make it too hard for you to get your entitled Medicare benefits. Now, someone has asked me this, how are these companies paying for this? How do these plans develop? So these are Medicare plans. They are being approved by Medicare. Medicare gives these companies money for you, each person, each member, right? Their goal is to keep you healthy. Because after Medicare don't pay, they don't look good. So, that's the goal. Part C, what's the advantage part of it? You get your dental, you get your vision. Some plans are getting over-the-counter. Food card. That's the biggest thing right now. Transportation. Those things. So, and that's what everybody's peddling, the food card. And I do say peddling. This is what we pretty much talked about. When choosing an advantage plan instead of original Medicare, staying on original Medicare, you must have Part A and Part B. If you lose, if you decide, well, I want an advantage plan, I'm not gonna play Part B, you're not gonna have an advantage plan. Because remember, these benefits are the same benefits. They're just being paid for by the private company. It's where your claim going. Your claim either going to the federal government or it's going to a private company. Who's paying my claim? Types of plans, HMO, PPO, we don't really see a whole lot of private fee-for-service, specialty plans. HMO, we used to that on our job. You gotta stay in the network. PPO, let me tell y'all something about PPO. It's a network. You can tell me, I want PPO. I want a PPO. So I want to go where I want to go. No, you're not going to go where you want to go. Okay? You're going to go in PPO network. Now, there is a cost that if you want to go outside of the network, you can pay more. But that doctor still has to say, Mr. Fisher, I will take your insurance. If the doctor say, Mr. Fisher, I'm not going to take your insurance, your PPO, you're going to walk out the door. Or you're going to pay him his money or her money because they're not going to pay for it. So it's this misnomer that if I have a PPO, I can go wherever I want to go. That's not true. You have a PPO, you can go outside the network if that doctor approves to stay and take your insurance and file the claim. Then the company can bill you more. Because you've gone outside of the person that they made a deal with. Right? So I made a deal with Ms. Loretta. Ms. Loretta said for all of my clients that comes to her, her real charge is $100. But she's gonna charge my clients $25. Okay? So everybody comes over to Ms. Loretta, I'm gonna have to pay $25 for you. But if you decide to come over here and go to Dr. Briggs, I don't have a deal with Dr. Briggs. Dr. Briggs don't want his whole $100. Guess what? You go over here to Ms. Brenda, you gonna pay $0 copay. I'm gonna pay her $25, we gonna be good.
Yeah.
This joke over here want $100, we gonna same thing she doing. Guess what you gonna pay? You gonna pay the difference, cause I'm not paying him. I'm gonna give him $35. And that's, y'all work it out. That's how PPOs work.
Wow.
Okay, they may have a $80, but it's gonna cost you more. Special needs, those are, we can talk about that. But special needs plans are chronic plans. Those gonna be those plans if you have diabetes, if you have heart conditions. Zinc is coming in if you have end-stage renal disease. Another special needs if you are on Medicaid. Because if you're on Medicaid, you got two insurance. You got what we call a dual plan. When Medicare don't pay, who's gonna pick up the 20%? Medicaid. Another one is the Medicare Savings Program. If you at QMB level and it's based on income, everything is based on income. Okay? If you at level QMB, you get less than $1,255 per month. That's just you. If it's your spouse, I think y'all can get $1,400. It's probably up here. But based on that QMB level, then the state is gonna pick up the 20%. So you have two insurance, or you have two payers. That's a dual plan. MA only plans are plans without prescription drugs. Okay, they're my veterans. They go to the VA and get their drugs. So those are veteran plans. Or that's for somebody designed that they get their prescription from a spouse's insurance or something like that. Extra help. Extra help is the commercial. You all see, it's pretty much the only legit commercial out there. Where the little black couples in the kitchen and they talking about the extra help and you know they having help with their prescription drug. That's legit. If you less than $19.03 a month, you need to get your extra help. Okay? Extra help plans give you a little bit more benefits because you're getting help with that. The state is actually, but no, the federal government is actually paying for those prescription drugs. Okay? And the basic plan, I call them the no help people. Y'all got too much money. Y'all don't get any help on anything. Don't ask me. You're not getting it. Don't talk to me about that. Y'all make too much money. People sit down with them. I'm like, how much your income? 2,100, girl, gone back. You're not getting anything. I don't make enough. Okay. Well, tell that to the person that got $200. And I do understand. I make a joke out of it, but I do understand. But I see incomes. And when you tell me you're getting $3,500, $4,000 a month, Lord, nobody's getting. Don't even try. Don't even think about it. You are getting nothing. Absolutely nothing. Okay? Don't talk to me about no food stamps. Don't talk to me about anything. Don't talk to me about a food card. Don't talk to me about pharmacy assistance. Don't talk to me about anything. Give back plans. I don't do too many give back plans because when somebody said they're gonna give you $100 a month back on your Part B, only veterans I'm gonna do that for those type of plans because they're gonna give you $100 back on your Part B. You don't think about you don't get that much them. Because it's a give and take. You're not gonna get everything. You're not gonna get $3,500 in dental and $100 back on your Part B. This is not. Those plans are designed for people that got beautiful teeth. They don't need dentures. They just need a little checkup. They don't really wear glasses. That kind of stuff. Those are the extras: fitness, vision, dental, mail delivery, over-the-counter allowance. Prescription drugs, Part D. Part D is the big thing, Inflation Reduction Act. So what that means is, this year, 2024, your max out, so we had 4 phases. Okay, this is where we are now. Deductible is $545, Initial drug phase is $5,030. So it's like a bucket. And it's got $5,030 in it. You go get some amlodipine, you don't pay anything, Humana pays $1. Let's pull $1 out. You go get some little sartan, you don't pay anything. Cigna pays $2. Let's get $2 out. You go get your Ozempic. You pay $47. Blue Cross Blue Shield pays $955 coming out of that bucket. You got $5,030. The goal is not to spend it all. Once we spend it all, we get into what we call the coverage gap. So now, instead of that Ozempic being $47 because it's a tier 3, it's 25% of $1,000. So how much you paying? $250. Around about 8 months, you're gonna be up to $1,000 between you and whatever drug company Cigna, Humana. Then you're gonna get over here. You're not gonna pay anything. It used to be 5%. But this year they said, well, you don't pay $8,000. You ain't gotta pay nothing. Okay? So next year, what's the next out of pocket? $8,000. Hold that number. Next year, here we go. No gap. Annual deductible, $590. Initial and the only max out of pocket is $2,000. After $2,000, you pay nothing. So, what's the difference between $8,000 and $2,000? $6,000. They gotta come over $6,000 for every one of y'all. So, if I gotta come up with $6,000 more dollars for you, what I'm gonna do with your benefits? No, don't cut some of that stuff. I'm not giving you all that dinner. Girl, you gonna have to fix your own too. I gotta come up with $6,000. Go get you a little discount card at the Vision Center. Cause no. So this is what's happening in 2025, y'all. They gotta come up with $6,000 on you. Now it's not fair for the people that don't take amlodipine. But I got someone in here that takes 2 insulins. It's just lots of expensive medication. $2,000 gonna help because at least we got a stock point. So this is what everybody was complaining about. The prescription drugs are just out of the, it's crazy. And the federal government could not negotiate with the drug companies. They could not. Next year they will be able to. So Medicare is shifting all these papers. Manufacturer, they'll be able to negotiate. They'll be able to get some discounts. So that's how this $2,000. So these companies are having to come up with these $6,000 difference. And so that's what they're doing. They're gonna take away some of the plans. We talked about enrolling. Okay, we know we in annual enrollment period. There are some, and then if you don't, I don't think anybody here really needs to change. But that we have October 15th to December 7th. Then we have another period for everybody that's on the Advantage plan. You get on the Advantage plan, it starts in January. You got like a 3-month trial period. You can switch again. That's only for the people on the Advantage plans. Okay, we got fitness. What we got? We're gonna talk about all that. Things we need to think about over time is like I was saying. I'm thinking about your money. I'm thinking about where you are. I'm thinking about your health conditions. I'm thinking about, okay, well, you got diabetes in your family. What's the likelihood that you're gonna have diabetes? It's very likely. You got congestive heart failure. It's very likely. So we're looking at all of that, and I am trying to analyze the money, and I'm trying to make sure you got what you need for health care. Okay. So one of these things, I don't know how many people I talked about, but a hospital indemnity plan. So anytime you hear the word indemnity, know that it has a goal. If you break a toe, it's gonna pay this much. If you fall, it's gonna do this. If you go into the hospital, it's gonna do this. So I call this my mini supplement. Why? Because this is gonna pay whatever you choose directly to you. Directly to you. My mom went into the hospital. She's on a Humana plan. This was in 2023. We brought in my birthday in the hospital. $275 a day, days 1 through 5. She was there 4 days. Her bill was $40,000. She she owed $1,100. Because it's per day, cost per day. She has an indemnity plan, it paid her $10.50. How much did she owe? $50. She had been on that plan since she was 65, she was on it about 5 years at the time. And she probably had paid over that period of time, she may have paid paid in like $1,100. So she was even. She pretty much got back. So usually if you use it within 5 years, or you really break even, you pay it. But for those people that remember we talked about the supplement plan and how much your premium was gonna be, can you save it? If you can't, go ahead and jump on one of these. So you ain't gotta worry about it. And these you can make them be whatever you want to be. They can be $600 for days 1 through 3. Be $500 for 10 days. $100 for 20 days. It's your plan you design. But the money comes to you. The check comes directly to you. So it kind of helps. One of those things, insurance, to try to ensure that we can have what we need. It's trying to prevent a financial hardship. That's what we're trying to prevent, is financial hardship. Okay?
Is it like Aflac?
It is Aflac, like Aflac. So Aflac is an indemnity. It's the biggest indemnity. But they are a little bit more expensive. Why? Because they paying Coach Prime and Coach Saban and Duck. So they got them commercials. But like Heartland is one, GTL is one, and those companies do gear specifically towards this population. They do have other products. They have cancer and all kinds of stuff. You got outpatient. You can do something for outpatient. You can cover your outpatient stay. You can cover cancer. You can cover dental. You can cover vision, all of that. When I was talking about the Medicare savings program, when people are getting $300 a month in food cards, $180 in food cards, then it's income related. When they call you on the phone, first thing they're gonna talk about is what? These extra benefits. Ain't that right, Miss Holly? Miss Holly called me, Miss Holly texted me. They tell me about the extra benefits, Miss Lyon. You better be on your job, though. I'm being and that's what we should be doing. And one thing I appreciate is that she's gonna always text me, but she's gonna always call me. So I tell people, I ain't gonna tell you not to listen. I want you to really not go. Because I know them. I'm not gonna necessarily tell you don't listen. Try today. Call me up. Because I'm gonna give you the truth. I'm gonna give you the skinny, no chasing. Okay? I'm gonna show y'all these plans. Next thing I'm gonna do. But here's the income limits. We're gonna take $20 out of policy. Okay? So here's the couples. Now these two will pay your Part B premiums. These two levels, SLMB, Q1 will pay the Part B premium. QMB will pay everything, the Part B premium, the co-insurances, the co-pay. So what's the difference between co-pay and co-insurance? So when you look and you see 20%, that's co-insurance. It's 20%. 20% on $100 is $20. 20% on $1,000 is $20. 20% of $10,000? A copay is $10. That's just what it is. So we want copays, we don't want co-insurance, okay? That's what we're looking for, copays, not co-insurance. This is what I was telling about the IRA. It expands the eligibility for Part D, low income subsidy. People that are on extra help, don't worry about that $5.90 premium. They're not paying it. People on extra help, you're not worried about the percentages on your drugs. You gonna pay $14, $11. You got $1,000 in, you gonna pay $14. Doesn't matter, because the government is gonna pay for those prescription drugs. I wish everybody, especially my tier 3 people. Those are the resources that you're gonna call me. That's me. Okay, so now I'm gonna do this. I'm gonna go over here, and we're going to, I'm gonna show y'all these, we're gonna get on these plans. Okay. Julian, what is it called?
What?
Here we go. Here we go. So, this is what the real deal. This is what we here for. Everyone should have gotten an annual notice of change, an A-knock letter. Y'all get it? Right. Oh my God.
Yeah.
This annual notice of change is one of the most important documents you're gonna get in the mail. If you want Cigna and Humana send you something, put Humana in the garbage. You don't necessarily care about what Humana, but don't throw Cigna away, okay? Keep your insurance carrier information. They trying to tell you something. And I'm gonna tell you something, they don't always tell me what they trying to tell you. They send this stuff out, we have no idea they're sending it out. Some companies let us know, we have to dig for it. They don't send me one, but they send you one. I'm gonna have to go into my portal, look up here, look up here, look up here to see what they sent you, okay? Don't throw it away. Check your mail. Please check your mail. Check your mail. Check your mail. If you see
Open
something
it.
that got a
Open
big
it.
T in with the red letters, please open it up. If
And
you
read
see
it.
the little bird, like Morris that bird, if you see it, please open it up. It's important. Don't throw it in the garbage. Okay? And then call me when they tell you they owe something. Yeah, you owe it because this document, they want you to fill it out, you didn't fill it out. You owe it. Okay? So, Humana. Humana is one of the biggest companies in this area. It has 30% of the market share. So everybody on Humana, okay? Most of my clients on Humana. I don't work for Humana, I work for you, okay? But the plan for, what's these people down here called? The no help people. Them the no help people. Y'all got too much money. They have the best plan for people that what I call the middle class. Because middle class don't hardly get anything. So, most of you all are on the 025 plan. The max out of pocket went up this year. You can come on and teach this, cause shoot, you done read the thing. So, two companies, two carriers in Shelby County that you can go to all 4 hospitals. 2. Humana, Blue Cross Blue Shield, Tennessee. That's important. Okay. One dual plan, you can go to all 4. That's gonna be a well-point dual plan. I know we are accustomed based on our jobs, one or the other per se. I am a little biased to that because I have had to run in between hospitals and change people's plans because they at a hospital they can't treat them.
Yeah.
Somebody tell you got stage 4 liver cancer, you don't want nobody talking about something like that. This plan, we gonna have to send you to Kansas. Who going to Kansas with you? This ain't really long when they in Kansas. George gonna be there. George is gonna take care of us. Oh, well, we might go to Kansas. We might be all right if we go to Kansas, but I don't know if we go anywhere else. We gonna be all right. But I mean, and luckily, that person had an SEP where I could change their insurance. You know, help people, y'all don't have that. Okay. So, $4,900 out of pocket, special still $0.25. They went up from $279 to $295. When you stay 6 days, it's $1,700. Okay? If you stay 6 days, $1,700 chunk change. Cause if you stay 6 days, your bill's $60, $70, $80, $100,000. I'm just gonna tell you that, you stay 6 days, cause they ain't trying to keep you in hospital. okay? Outpatient, ambulatory surgery, there are co-pays for every plan on outpatient, every plan on ambulatory surgery, every plan on PT, every plan for MRI. People call me complain about that MRI. The MRI costs $5,000, $7,000, $8,000. I know $300 may be tough, but you don't want to pay $5,000, $7,000, $8,000. These scans are expensive, and I'm not gonna let you complain. I'm gonna say, "Ooh, thank the Lord, it was only $3,000. Hallelujah." And you gonna be probably holding this phone like, "Girl, you finna pay this $300 for me?" But when I look at the perspective and I know how much it costs, I was in healthcare for 30 years. That's a drop in the, now we don't wanna pay it. I mean, but, you know. So all of your outpatient, $20. Go over here to Blue Cross Blue Shield. Up here, $0 premium, okay? Blue Cross Blue Shield is a PPO. It has always been a PPO. All their plans are PPO. So there's the $295 days 1 through 5, inpatient. Out of network, $17.25, in network, $14.75. But look at this copay. So $300 and $325, $255 and $275. So when you get through switching, what we get? Not much of nothing.
Right.
I'm not gonna tell you not to switch, because you tell me what to switch, but guess what we doing? We switching. We doing whatever you say. Okay? Cause it's not my healthcare, it's yours. And don't let anybody else tell you it's not yours. You have to advocate for yourself. You gotta teach your family to advocate for you when you go into these hospitals and these people wanna tell you, well, they're not gonna do this, no, you're gonna do it. You have to advocate. No one can stay in a hospital by themselves. We got some great nurses, we got some great doctors. I'm a healthcare worker. I'm not talking against any of that. But I will just tell you the truth. If don't nobody see anybody come seeing you, ain't nobody studying you. I'ma dip in your room, I'ma take your body sign, maybe, write something down, and But if you see me running in and out, you might have to answer them. Now, we gotta clean them up with their daughter coming. She gonna act up. Yeah. Now, you got some great healthcare workers that you don't have to do that. But
Right.
I'm just saying.
Right.
Okay, let me move this on. Okay, United Healthcare, there you go. 030, they got a PPO and an HMO. 030, anytime you start getting PPOs, your co-pays are gonna go up and your benefits are gonna go down. Cause why? They're gonna have to pay a little bit more for your PPO. Devoted is the only company in Shelby County that's gonna give you people with money some help. They're gonna give you $91 a month that you can buy you some food. That's the only one gonna give y'all some help. Some bread and some milk. Now, if they gonna give me $91, why you ain't told me to get on that plane? I know that's what y'all asking me. Y'all look at me like, girl, you don't mess me, miss them $91. That shit was 75. Man, give me my $75 per month. Well, I probably didn't tell you because your doctor wasn't gonna take it. At the end of the day, food, dental, vision, card, it ain't gonna matter if you can't go to the doctor. It's not gonna matter if you land somewhere and you don't even know you here. You don't even want anything to eat. Now your folks might be using it, but you not. So, Devoted is not necessarily a bad plan. They came in, they're new, they're 3 years in Memphis, they came in with these great plans. All this money, all this dental, all this vision. Guess what? They can give you all of that. We're number 3 people on the plan. United Healthcare is the biggest healthcare company in the United States. Humana right behind. They got millions of people on these plans. They can't afford to give you all that. But people got 3, they give you all that. Now, guess what happened this year? They're gonna give you $91, but look at this dental. It only went from $5,000 to $1,000 reimbursement. That means you gotta pay for it. You gotta pay up front. They are on the Baptist network and the Methodist network. So my clients that are on devoted, it was probably because they're $75, people get help. I want you to get as much help you can. Most of those people have one doctor. Their doctor was in the Methodist network, their doctor was in the Baptist network. So it's easier for them to go over there. Now, my other rub is you can't go to the regional one. I talked to a client, she said she was good with it. I'm gonna tell you. Every other person, you can go to St. Francis, Methodist, and Regional 1. So, Humana, Blue Cross Blue Shield, all 4. Devoted, St. Francis, Baptist, Methodist. Everybody else, Methodist, St. Francis, Regional 1. Okay? So this is what these plans look like. Oh, I didn't fill in well point on that one. Blue Cross Blue Shield has a couple more plans. They $96, $157 a month. Everybody don't do that one. And it doesn't have a regular plan. Cigna didn't change much, so my people that's on Cigna, you know, those stayed the same. Some of these I was just getting a little bit late, so LIS plan. LIS plan is once again prescription drug help. So they do have premiums. If you see up here, they have a premium. But no one is paying this premium because they get LIS. No one is paying this deductible. Humana, you looked at your Humana, you probably had a deductible $590 for tier drugs 3, 4, and 5. Remember, they making up that $6,000. So where you had no deductibles, you're gonna start to see deductibles on these plans. Okay, you're gonna start to see the dental and vision go down. So on these plans, got lower copays. They designed for people that's getting help. So they got lower copays. Look, they pay $155 going to the hospital. The other one was 2, 3. Okay, Humana, Blue Cross Blue Shield, United Healthcare, Cigna, Aetna. Cigna got 0, 0. 0 for primary care, 0 for specialty. That's a big deal. Okay. Now, can anybody get on this plan? Anybody can get on this plan. You wanna pay the premium, you can get on this plan. Now that the $2,000 max out of pocket has kind of cut that down, then when you start looking at their deductibles, start looking at their drugs, y'all don't have deductibles because why? These people not paying it anyway. But now that we got an even playing field of $2,000, then you're not gonna pay over $2,000 no matter what plan you on. So you can consider this plan if you want lower copays. If you had to go to the hospital. Now, you're paying the premium. So I just do the math. Is it really a savings or not? It could be. So that's how I always do the math. If I sit down with you, you know I do the math. Now this is what everybody wants. I always want this. I want this. Cause what's on there? What's on there? Nothing but zero. Oh, and I want this. But these are our dual people. These are the people that's either on Medicare and Medicaid. And if you're on Medicaid, Medicaid is for children, pregnant women, and the disabled. So do we want it, but we don't really want it. I want it, but I don't want to have to be in a situation to get it. Okay? Or my income, if I'm a single person, is $1,255 or less per month. Okay? But they pay absolutely nothing. So, let's go over here. Oh, moving on. Somewhere here we probably got a food card. Here we go. $290 a month. $336 a month. $230 a month. $300 a month. $280 a month. I will tell you, United Healthcare gonna give you the most. That's what they do. Talking about food card, dual, you getting the most. Now, their dual network is not the same network as their regular plans. The regular plans is AARP. The dual network is not. So guess what? Shrink. Because to be on the dual network, that doctor has to take Medicare and Medicaid. And not all doctors take Medicare and Medicaid. So now you're shrinking your networks. Humana has the biggest network. You're not gonna beat the network. Humana is the easiest company to travel around these United States of the Americas. They in all 50 states. They don't require referrals. You can go in and out, do what you want to do, visit folks, do whatever you want to do. I have a veteran, went to Germany. He said, I slapped that thing down like I was in the United States. He said, there ain't even a question. Every company's gonna pay for an emergency. Don't worry about it. If you out of your area and you have an emergency, go to the emergency room. Call 911. If you are having chest pains, the very first day you have chest pains, you cannot breathe, please call 911. Don't tell nobody to take you to the emergency room. They can't drive and pump on your chest. They cannot drive and give you no IV. Please call 911. Please. Yeah, you're gonna have a $300 copay. But you're gonna be living. I'm not gonna be trying to run to no repast and no funeral. So that's my spiel on it. Let's see. Don't call your children. Don't call them to tell them that you can't breathe, because guess what? You cannot three-way 911.
Right.
Call 911 and then call your children. Okay? Veterans. Here's my veterans. Now my veterans will give back. You know? Okay? My veterans got to give back $105, $140, $40, $100. So here's the give back plan. The veterans don't have prescription drugs. There's no drugs on this plan. So they get you're welcome. They get a lot of like they on Humana they get a food card, and this year they got a food card and over the counter. They get a little bit more benefits. They're hot. Look at this copay, $150. Low copays. And they actually get a food card on that one. Low copay, United on with it. So you all will know this. Depending on what group you in, is depending on what companies I already go to. Because I already know they got the better benefits for you. Okay. Now you can go to any of it, but I'm gonna be trying to make sure you get chronics. These are for my diabetics. Biggest thing about chronics is that we're worried about trying to get those diabetic, those extra things like those Ozempics and those CGMs covered and that kind of stuff. Now, there's only one company I'm gonna put you on a chronic in Tennessee. That's gonna be United Healthcare. I'm not gonna put you on Humana, because they're crazy. They're crazy. You're gonna have to have extra help because your drugs is gonna be so expensive. Now, I mean, we got this $2,000 each plan fee, but look at this copay. Who's gonna get them $21.85 per visit? They not doing that. So, if anybody was a chronic in Tennessee, you were on United Healthcare. If you were chronic in Mississippi, you were on Humana. They took the food card, so most people want to switch. Okay. Give back plans, I don't really do them unless you just want them. I don't push them. I don't really talk about them to people because most people need their deal on their vision and their other benefits. Supplement busters, these are for people that are actually on supplements and it's getting to be too expensive. So with these plans that come up, and there's some more, we just don't have them on the slide. You paying this premium, but look at that, $0. So that's for the people that can afford the premium, but they don't have to pay for anything else. Acts like a supplement, but you know, max out of pocket is $3,000. Theirs is, I don't think it's $0, but but it acts like that supplement. And you getting your dental and your vision and all of that. So you're still getting all those extra benefits. You paying the increased premium, but you're not having to pay the cost to go into the hospital. Okay?
What is that?
I call them a supplement bus. They're still an advantage one. Another option we did not talk about, because most of you guys are not on it, but I'm having a couple of calls about it and meetings with people about it, is your job insurance. Your retirement insurance, most in city schools, like it's water, post office, most of those retirement insurances, you're paying for them, but they are advantage plans. These companies are going to these advantage plan type models, but they're $0. So they are advantage plans. You pay the premium because when you have to use it, they're $0. And so what I tell people, when you come off your job, just take a look. You don't have to change, just take a look to see what your insurance, how it is going to be. If they offer you retirement insurance, what's it compared to the Medicare? If you Fed Blue, what they do is they'll let you try it. So if the school's gonna tell you, you get out, you're done. You're done. Now, why? They don't wanna pay for your stuff. Memphis Light, Gas and Water is going to require that you take Part B. They don't wanna foot the bill for you. They wanna just take that 20%. They'll pay that 20%. They don't wanna pay the whole thing. Other jobs, they are more and more jobs are requiring that you take this Part B, and they will do the 20%. You're gonna pay a premium, it's not gonna be for free, but they will do that 20%. And so they're requiring it because healthcare costs a lot of money. I sell group insurance to companies. I'm seeing their healthcare costs. Their employees not necessarily paying, but that job is paying. So it could be a lot of money, so they want you off their dime. You don't work for them anymore. So they gotta work you off their dime. Questions, comments? Yeah, I got some questions. This is an example of your annual notice for change. It's a whole booklet. Plenty for you to read. I only had one star student in here that read his book.
I read two.
You read?
I read two.
I So this is the stuff you get in the mail. So this is the average time. What they have on there? $91. Cause what is one? Once you see this $91, I'm gonna get $91. Who gonna get that? I'm gonna give me $91. You gonna call the number. They're gonna tell you about this $91. They're not gonna talk to you about it or anything else. You know, it's not a bad copay, it's not a bad company. There's no company that I just say, you know, it's bad. There's some that don't pay their bills.
Which one was it?
The one I ain't talking about.
Yes.
I ain't talking about many of them. One of them is notorious for not paying their bills. And it starts with a W. And they don't have a point on it. So there you go. I sell them all. If you want them, get it to them. If your doctor's network and it works for you, I got people on every company in here except Zine because they're brand new this year. But I have people on every company in every company that's offered because it works for them. I say you can try it. If it don't work for you, we'll put you on something else. Really, you ain't got but one time this year, next year to get on it. And that'd be January through March. You know, some people have that one doctor and they paying him, so they fine with it. They're not going to the hospital, you know, this and that. But when you get the advertisement, you know, I'm only gonna tell you about what you know. You wanna listen, call me, text me. If I don't pick up the phone, it's Medicare season, I'll call you back, I'll text you back. Let me know a little bit what I need to do, because I don't have my file in front of me. So I'm gonna have to get your file, we're gonna have to look at it, and I have to look at your doctors, and now this, the formulary is a big deal this year. These companies are changing these formularies. They're kicking the drugs just off the formulary, they say they're not covering it at all. Okay? If you go to the hospital, I wanna try to send out, remember I don't have my card, try to send out little magnets for the refrigerator. Your children need to know my number. My magnets, but they got, those are Humana magnets. You can pick up a magnet, it has the phone number, it has my cell, it doesn't have the office. And I'm trying to send out an updated magnet with my card, because if they have questions about your health care, they don't know what your stuff is, they don't know. They go in your wallet, in your purse, and they find your card. And some of them have called me when they found my card, but they really don't know what you're on. Let them know. This is my insurance agent. Call her. I need to know you're in the hospital anyway. I don't wanna get a inbox a month after you gone and say, oh, your client is gone. If your money changed, let me know. We're gonna try to get some extra. You got questions? Put a message in the model. Send me a note. Let me know. Let them know to let me know. It may, sometimes I will not lie. Sometimes it is gonna take me a minute depending on, I'm like the ER trying to triage. Figure out who got the worst problem. And it may take me, I try to do it within a day, sometimes 2 days to get back to you. But if you have a problem with billing, that EOB is important. EOB, explanation of benefits. If it has 0 on there, don't pay the doctor $50 because they called you and said you owe them $50. Or they sent you a bill. Your insurance said you don't owe them anything. Don't pay them anything. It's up to them to get their money. They made the deal with the insurance company, not you. Don't pay them your money if you don't owe it. Okay? It's up to them to get their money. That's why it's called an explanation of benefits. Keep it for about a year. It's a year old, toss it every month. Just toss the other one over. It details everything that has happened to you. If it say you went to the doctor on the 5th and you went to the doctor on the 10th, something wrong. Somebody done put a claim in that wasn't you. Open them up. Read them. Pay attention to them. Okay? That is your diary of your health care. So it is very important. Okay, any other soapbox I got?
Yeah, I probably should. Well, you know, like if you want your benefit to stay the same, and you know you can open enrollment, do we have to change anything?
You don't have to do anything.
Okay.
If we don't stay the same, we don't have to do anything. That's why we're having this meeting. I'm telling you, you're gonna stay the same. We're not doing anything.
Oh,
You're gonna try it. Let me try to find somebody. I don't think. We might. Maybe not. I'm trying to figure out.
will I change?
No, I don't think so. Now, everybody here on Humana, I think.
Yeah, I am on.
Yeah, no Humana people are really changing this. You want to go to Blue Cross Blue Shield. You are not going to the vote.
What Blue Cross got that?
The difference is a little bit different in the copay. But one copay, like their inpatient is $275 or $295 for days 1 through 5, Humana days 1 through 6, but then your outpatient is $255 to $300. So if you switch it for one, it may be, so it's not that big of a difference. So unless there's a huge difference, I just don't suggest you change unless your doctor decides she's not gonna take Humana. So those people we got to do something. Either we're gonna get a new doctor or we're gonna get a new company. But I'm not suggesting that really, I'm trying to think. Tennessee is really solid now. My Mississippi now, I've been working on them. But my Tennessee is fairly solid because it's really not that big of a change.
Yeah, I'm gonna change that thing there was like an avalanche bill went up.
All your copays going up.
That little credit card
Went down. No, your flex went down. Your flex card for your dental vision and hearing on the 025, it went totally away, but you still got $2,500. Still got $200. It went away. That was $500 they was giving you every, remember $6,000, $2,000. You ain't even so see how people, see what the people do? This is what the people do, y'all. You don't use the stuff, then they take it away and be like, I need my stuff. So, and then that's what so this is the thing, and now we're gonna close. Use all of your benefits. Because December the 31st, they're gone. If everybody's in Humana, go and look and see if you got some 365, go 365 rewards. If you had a wellness, you got $25. If you've had a colonoscopy, you got $50. If you had a mammogram, you got $50. If you a diabetic, you do your 4 things, I think you got $50. Go in there and see. Now, this is the thing. Okay, hold on now. Hold on, horsey. Ooh, if my class don't stop, you just don't remember. We went over it, but I'm getting all that good stuff for you. These companies, is getting away from this paper. Okay? You're gonna have to get you an online account. You're gonna go to humana.gov.com. You're gonna go to humana.com. I think if it's Cigna, my Cigna. It's Blue Cross Blue Shield, my Blue. You know, each one of them has an online account. Aetna's not even sending us, we can't even order books from Aetna this year. I don't like it, because I don't like to read online. I want me a books. But they're going to these online accounts. Why you need these online accounts? If you lose your card, you go to your online account and show the doctor, here's my card. If you got an issue with a claim, you go to an online account and say, oh, baby, had a person call me so mad at you, man, I won't offer this. They won't pay for anything. My doctor put in a referral for my husband had surgery 3 months ago. They won't approve anything. I said, for real? Okay. You got an online account? I said, you sure the doctor put in a referral? Yeah, they told me they did. Let's go to your online account. Guess what? They ain't put in nothing. Now you finna get mad at Humana. We mad at these insurance companies, but who we need to be mad at is these doctors out. That's who you need to be upset with. But you don't know that unless you got an online account. You don't know that unless you go and say claim and see there is none. If Humana denies your claim, they're gonna call you and say, we denied it on the voice recorder. If Cigna denies your claim, they're gonna send you a letter. They're not telling these doctors no more than what they're telling you. You are the client, not the doctor's office. Open your mail. Listen to your voicemail. But if you got an online account, you go in there and you click, they deny my claim. That EOB, you go in there, you gonna see that little yellow mark. You know what? A lot of them you go in there and look, guess what it say? Bill twice. Bill that was already in another bundle. Can't do that. I've done billing. Transcripting. Can't do it. But you don't know that. Cause you listen to that person that you went in there and she's so sweet. No. I did this position. She sent it to somebody, and they didn't do it. But guess who you gonna believe? The person in front of you. Right, that's what we do. I mean, that's what any of us do. That's what I would do. But get your online account, okay?
Is that every month or?
EOB is gonna be monthly, and it's gonna, and it can be twice a month. If you going doing multiple things, they're gonna send everything out. It's usually monthly. And sometimes people opt in for this email, then you don't check email. I'm not gonna opt you in for email. If I enroll you, you get paid. And then I say, if you want email, you go back and do it yourself. Cause I already know we're not gonna look at the email. If you're not on the job, most times you're not looking at your email. My guy who got 30,000 emails. Cause they just keep, So and I would say you can sign up now. If they got text, that may be a good thing. To at least text me, let me know to go look. But that email, I don't know if you're gonna do that. But I signed up everybody to get paper, and then I allow you to go in and do whatever you wanna do on your own account. But we gotta get an online account, cause it's a powerful tool. You can change your PCP. You can look and see if that drug thing gets gave, you're gonna be covered, how much it costs. It's a powerful tool. And you can look for a PCP without even logging into your own portal. You go to Cigna.com, Humana.com, BlueCrossBlueShield.com, UnitedHealthcare.com. I mean, everybody got .com. You don't even have to look it up. I mean, you gotta log into your portal to find a doctor, to look and see if your prescription is gonna be covered, how much it's gonna cost, all of that. That's important. Okay?
So you, well, I want to kind of
confuse it. Now, every so often, I get a letter or call or something, that say, if I don't use my medication, then the guy got $85 or $35 left up in there. If I don't use it, I'm off medication, period. And so what happened to that little $35 that be up here on the card?
You ain't got no $35 on no card. You don't, who's giving you the message? Who's sending you the message? The pharmacy?
Well, I was on medication,
Mm-hmm,
and I finally got away from medication.
mm-hmm,
So I go up there and try to get, I'm just saying some over-the-counter stuff,
mm-hmm.
and I slide my card in there, and it said denied.
Okay, your prescription drugs, okay, if you got over the counter, so this is the thing, you are on Humana.
Right.
You cannot buy over the counter in the store on Humana. You must order it out of the catalog. That card that you're trying to slide is not for over the counter, it's for your vision and dental and hearing. Okay? So, couple of things these companies do, they're condensing cards, they put multiple benefits on the card and that kind of stuff, but that particular card will go away next year anyway, and it was never for over the counter. On Humana, you must order it out of their catalog. Unless you have a visa, unless you're on a dual plan, or you on that, extra health value plus plan. Everybody else has to order out of the catalog. And even when people have cards, I tell them to order your over the counter out of the catalog. What you're gonna do, is you're gonna go pick something that's not approved. You're gonna get to the counter, and then you're gonna be upset because it's denied. And everybody standing in line, and you're gonna be embarrassed, and now you're mad, and this and that and the other. Just order the stuff, let them bring it to your house, and sit it on your porch. And if they gonna steal it off your porch, tell the neighbor that they about to bring your stuff to your house, watch my porch, because they gonna steal it off my porch. Okay? I mean, it happens. So, but, you know, and the more and more these companies are gonna go to where you're gonna have to order off the online catalog. That's how they control costs. And some people tell me, well, it's not this brand name. Well, I guarantee, I promise you, it ain't hurt me at all. Cause my mama is on Humana and the whole family uses the over the counter. You think we ain't upset about stuff going down. Actually, she has one that's gonna go up a little bit. But, I mean, the whole family uses it. And the thing is, it's not brand name to us, but it's brand name somewhere else. All this is not brand name to us, but Kirkland is brand name somewhere else. You know what I'm saying? So, that's kinda how it works, okay? Any other questions? I appreciate you all for coming out, I really do. I really, really do. It's so good to see y'all. Like, I haven't seen some of these faces. So it is actually good to see you all. You have friends, families, refer them, I'll answer their questions, you know, do a meeting for the church, whatever you all wanna do. I'll make myself available because what I wanna do is get the correct information out. That's the most important thing, to get the correct information out. And to make sure that we are aware of the things that are going on.